Good afternoon, everybody. Scott Mayboy here, out on the beach. Kind of fogged in today. Gorgeous day, actually. Out here on the beach. Let's see. So I was going to actually talk about Part D drugs because I spoke to somebody yesterday and posted about that. On January 28th, he told me, or 29th or something, he told me he had no drugs. And then on the 2nd, he goes and fills a prescription that he had. And guess what? That particular drug, the plan he chose, was not the best plan for that particular medication and wouldn't have put him or recommended that plan had he told me that in advance. But he did not consider it a prescription because it was eye drops. So can't stress enough, whether you use me or you do it yourself or you go to someone else, you have to use accurate information because the response, the recommendations are only as good as the input, and if the input is flawed, the output is as well. But that actually isn't what I intended to talk about. Just had 2 calls back to back. One with a current client. He signed up, I think it was for January 1st, and he was just diagnosed with cancer, and he was just calling to check in about his plan to see how it would be impacted with the treatments he was anticipating going through, and they caught it early, and wanted to know if there was a better plan that he should consider for what he anticipates going through. The other guy who called me is a referral. He actually hasn't signed up yet for Medicare, and was just diagnosed as a very bad case of cancer, unfortunately, in his case. He wasn't sure if he should move forward with the plans we discussed to go on Medicare. He's currently still working and was going to go off the group plan at the beginning of March, and asked me if he should bother or if he should still just stay on the group plan and go with Cobra. Not sure how long, what the future holds for him. And my recommendation was, because he had wanted originally an Advantage plan, and I'm a fan of Advantage plans, don't get me wrong, but I think in this case what I told him is there's a cap, there's no premium, and there's an annual cap, but let's first, do you anticipate more than the $2,400, give or take, of fixed expenses the supplement would have? And, as I said, not to sound cold, insurance is dollars and cents. And if you think that the treatments you're going to go through, whatever they may be, are going to exceed $2,400 in copays, you're better off with the supplement. Plus, the supplement will give him the ability to go get second opinions and see specialists and whatnot without any concern about a network. So while I'm a fan of Advantage plans for healthy people, in this case, I said I think the window for him to have an Advantage plan is probably past. He could certainly sign up for one. But I think from a cost perspective, an ease of use perspective, the fact that he won't have to worry about any copays going forward, or almost no copays going forward, the supplement's a great plan. I mean, I wish the circumstances were different, but from an insurance perspective, at least he can get done what needs to be done, go where he wants to go, and not worry about networks and copays and maximum out of pockets and all that nonsense, and just focus on what he wants to focus on. So, in both cases, the first guy had a supplement, the second guy I'm recommending a supplement, and in both cases, I wish them both well, hope it all turns out for the best. But I think when the decision you need to make between supplement and Advantage plan when you're not well is what do you anticipate for out-of-pocket copays, and if that's going to exceed approximately $2,400 a year, you're probably better off just going with the supplement and not worrying about the copays. And hey, if everything works out and we can next year revisit and he's got a clean bill of health, we can always switch to an Advantage plan during open enrollment. If you have any questions, comments, you need help with anything, there's no charge to work with me. Give me a call, happy to answer questions. Have a great day, everyone. Stay safe, watch for ice later, and be well. Talk to you soon. Thank you. If I can find the finish button.